You had acne as a teenager. It was miserable. You dealt with it. It cleared up. And then, 20 years later, it came back. Not a couple of casual spots. We are talking about deep, tender, stubborn breakouts clustered around your jawline and chin. Now, this is understood skin symptoms of perimenopause and menopause. Let's understand the why before we get into the how. Estrogen keeps the testosterone levels in balance, which in turn keeps the oil production in check. In perimenopause, estrogen drops faster than testosterone. The result? Your skin oil glands get more of the testosterone signal than they used to. More oil means block pores and bacteria. And you get the deep, painful breakouts along your jaw and chin because that's where androgen receptors are most concentrated in the skin. The medical name for this is relative androgen dominance. And here's the important thing this isn't a disorder. Most women in menopause acne have completely normal testosterone levels. The blood test comes back fine, but your skin is still reacting because the balance has changed. Around 26% of the women in their 40s experience this, about 15% in their 50s. The acne looks the same as when you were 17, deep, angry, on your face. So you reach for the same things that worked then. That makes complete sense, and it's almost certainly making things worse. Here's why. Teenage acne happens on the skin that is naturally oily, thick, and producing collagen at full speed. Those strong washes and stripping toners were designed to cut through all that oiliness. Perimenopausal skin is different. It's doing two things at once that don't go together. It's breaking out and it's drier, thinner, and more fragile than it was 20 years ago. The same hormonal shift also reduced estrogen's role in keeping your skin moisturized and elastic. So, when you use a strong foaming cleanser or a high strength acne wash, it strips the already thin moisture barrier your skin is struggling to maintain. Your skin responds by producing even more oil to compensate. The breakouts get worse, not better. Let's get into the how now. Tier 1 is about daily routine swaps. The foundational principle treat the barrier first, then target the acne. Cleanse gently. Switch to a gentle, non foaming, low pH cleanser. This removes excess sebum and debris without stripping the barrier that your skin is already struggling to maintain. Look for the term non comedogenic, means it won't clog pores and fragrance free. Gel cleansers work well for combination perimenopausal skin, cream cleansers for drier types. Moisturize before treating. This is a step most women skip because they are worried about adding moisture to the already oily, breakout prone skin. But a lightweight, non comedogenic ceramide moisturizer applied before any acne treatment actually reduces reduction and prevents the reactive sebum overproduction. Apply SPF daily. Perimenopausal skin is more prone to post inflammatory hyperpigmentation, the dark marks that breakouts leave behind. SPF prevents those marks from deepening and is an important step for preventing the long term skin impact of hormonal breakouts. Before we talk about the products that do help, there are a few situations where acne during perimenopause deserves a proper medical assessment. See a doctor if the breakouts are accompanied by significant facial hair growth or voice changes, rapid onset or severe worsening of acne in a short period, hair thinning on the scalp alongside the breakouts, significant menstrual irregularity or pelvic pain. These can indicate other conditions such as PCOS, which is polycystic ovary syndrome. Let's go to the ingredients that work on menopausal acne, specifically in tier 2. If I could recommend just one over the counter ingredient for menopause acne, it would be niacinamide. Why? Because it tackles several problems at the same time. It helps regulate oil production, it calms inflammation, it strengthens the skin barrier, and it gradually fades the dark marks that acne leaves behind. A serum containing 4 to 5% niacinamide is a great place to start. If your biggest frustration isn't just the pimples, but the marks they leave behind, look at azelaic acid. It reduces inflammation, helps unclog pores, fights acne causing bacteria, and helps fade pigmentation, all while being gentle enough for sensitive perimenopausal skin. If block pores are your biggest issue, a low strength salicylic acid serum, around 0.5 to 1%, can help keep pores clear without stripping your skin. Use retinaldehyde instead of retinol. It encourages healthy skin cell turnover, helping prevent clog pores while generally causing less irritation than traditional retinol. And finally, if you like using benzoyl peroxide, a 2.5% spot treatment applied only to active pimples can be very effective. Remember, we are treating acne. Now, what if you have done all of this. You have been consistent for 2 to 3 months, but those painful breakouts still keep coming back. That's when it's time to have a different conversation. Let's talk about the prescription treatments and one hormonal option that can make a real difference. If over the counter adjustments haven't brought relief after 8 to 12 weeks, it is time to move to tier 3. Ask a dermatologist about spironolactone. Unlike topical creams, spironolactone is an oral medication that directly blocks androgen activity at the skin receptor level. It is widely considered one of the most effective treatments for adult hormonal acne. If you are experiencing jawline acne alongside hot flashes, brain fog, or sleep disruption, discuss your full symptom picture with your doctor. HRT restores systematic estrogen levels, which naturally rebalances the androgen ratio and often clears skin as a secondary benefit. Finally, address the stress layer. When you experience chronic stress, your adrenal glands produce cortisol, which simultaneously simulates androgen activity and oil production. Managing sleep quality and stress isn't just general wellness advice, it is a direct biological strategy to calm your skin. You dealt with this once already. You shouldn't have to deal with it again without understanding why it came back. First, repair your skin barrier. Second, introduce one proven ingredient at a time. Third, give your skin enough time to respond. And if those deep, painful breakouts keep returning despite your best efforts, don't just keep buying more products. Talk to a healthcare professional because you have options. If this episode helped you understand what's happening with your skin, subscribe to Nobody Told Her. I'll see you next week.